Debbie's ready.
Yes, well.
Morning, everybody. We're going to start the Human Services meeting. Dan, thanks for making it a forum. And we'll start with the minutes for March 29th.
Second.
All in favor? Thank you. Okay, so Shelley, would you like to come forward?
Well, that was fast.
Thank you.
Be here at 1 o'clock like yesterday.
Thanks for having me. Good morning. I'm Shelley Smith, Executive Director with LEAP, and I'm here this morning to recommend Paige Foote as a potential appointment to the Saratoga and Washington Workforce Development Board. Paige is the manager of Maplewood Ice in Whitehall. She's already engaged with the Workforce Development Board voluntarily on a couple of occasions, participating in the truck rodeo, and also attending a meeting as an observer recently. I spoke with her, and I feel like she has a good grip on not only the barriers to employment that Washington County residents experience, but also the needs of Washington County employers. And she's excited to be on board and to be a part of the Workforce Development Board and start engaging with the on a higher level with the workforce in the Tri-County region. She would be appointed for a 3-year term, which would be May 19th of this year to May 18th of 2026. And that's my request, that you would take this to the full Board of Supervisors for approval. Yes, she is a resident of Washington County and her business is in Washington County.
Any discussion? All in favor?
Aye.
Thank you.
Thank you very much.
Okay. What?
Morning, sir. Morning.
Okay, so first item here is a resolution request to accept 100% state aid from the New York State Office of Mental Health, $60,592. This is pass-through funds designated for school-based mental health clinic services. We have our providers have established satellite clinics in every school district in Washington County except they have a physical presence on site and ability for youth to access those services on site at the schools. This is one-time funding from the Office of Mental Health. They call it supplemental funding, designated for enhancing services through training, supplies, equipment.
It's one time, we expect it every year, or
No, I don't think so.
just every so often?
Yeah.
Sorry.
Any discussion? All in favor?
Okay, the second item is that longer table there. I just wanted to talk a little bit about county was has been designated. Our office has been designated on our Washington County State Aid letter to receive additional $263,500 this year. And you see that number on the table there in the lower table under Washington County. So these two tables represent the opioid settlement funds. The table at the top represents what is really the county direct funds. And these are just estimates, really. And these numbers will change because they don't include some of the latest settlements that are going through. The table at the bottom are what they're calling LGU abatement funds. These are a local government unit, which is our office. They call them abatement funds. They combined 22 and 23 into one payment. And you can see for Washington County, that'll be $263,500 coming this year. And then it projects out over the total 18-year period of the settlements. And you can see that for Washington County, for the abatement funds, it will total $933,997. There are some years there where it's trails off to lower amounts. So really average annual will be about $54,900 over the period. But again, this doesn't include some additional funds that are coming in from other settlements. So these numbers will change over time.
So it's low number. Budget process.
We know if
It'll
it's,
be hard.
do we know if we're halfway along in the settlements or there's a lot more still to come probably?
There's probably more to come.
Walmart and Walgreens.
There's all, and once again, the state and its infinite wisdom is uncoordinated, unsubstantiated, and on everything else in the planet. Because some of it comes to us, some of it comes to him.
All right,
Some of it goes to the state to be held for them to go for grants. Some of it goes somewhere else, and nobody quite knows who's getting what and where.
well, there's really nothing to work off. You just kind of add it as
Right.
it comes in. You can't
Right.
budget it,
So, except for this,
except for what we know right at the moment.
it's another disaster really tobacco was.
Like the state budget.
Well, they're trying to not do tobacco by restricting the funds. They don't give you, so we don't know what the rules are for restricted funds. We don't know how to get access to them. They haven't done anything.
Well,
It has made the planning, a little bit hard for it because you can't supplant either. So you don't know what the state's doing exactly with their funds because they're making some funds available directly to providers. So it's hard to, been a little bit hard to figure out how we're going to plan and go forward. And as Roger mentioned, there's these different buckets, the county direct funds, and now those are restricted, half unrestricted. And now there's this other bucket, but I think I probably need a resolution to recognize the revenue.
Any more discussion?
and that's just for 23, right? We're just moving 23's funds, so we don't have no idea what they're gonna do later.
Yes.
Well, may come over that stuff. Yeah,
So the motion would include the amount of 263,500.
yeah, just 23's.
Any additional money that's coming forward would be
We'll
back?
come back to this later.
I'll come back with that. And
Probably not come to 24 now.
So we've got a motion and a second, and any more discussion, Dan?
Just to run on this spreadsheet, you said these numbers are gonna change. They're never gonna go lower though, that's right? So these are a good bottom line number.
yeah, I mean, it's kind of a good faith estimate because
Right.
what they did is they told us they gave us a total for the region and they said you estimated based on your percentage you received this year of the regional pool.
Yeah.
So they had a projection of the regional amount over the 18 years, but not specific to our county. So it's sort of had to do a little math just to make the estimate. But again, they won't go lower. The numbers will be higher.
Right. Thank you.
Okay, so all in favor?
Aye.
Yep, that's all I have.
Thanks, Rob. Thanks very much. Okay,
morning. I'm filling in for Mike again. Good morning.
You sure?
I'm pretty sure. I'm pretty sure I'm filling in.
We'll
He's
work
not
on
here.
changing that. in a minute.
Yeah, I was gonna say.
For today. And I'm already gonna blame him for something in here that we neglected. to put in there.
3 times.
Yeah, I'm blaming him. All right,
One's down.
that's one. That will be one.
2 more.
First time.
So first, we need a budget amendment to add 41,443 to the applicable appropriation code. That was runaway, a pass-through funds from runaway homeless youth that goes directly to the White House. And then, of course, to add it to permission to add it to the revenue. And that was funds that was increased. We really had no idea. It wasn't in our original budget. It was an additional funds that we did not know that they would be getting.
Any discussion?
No? And then we
Uh,
also, oh, sorry.
The line G on your data request form says total dollar amount involved 88,974, but then the budget amendments for 41,443. What's the?
Yeah, so the 41,443 was the additional dollars we already had. So the total amount that we would be contracting with the White House with permission would be the 88,974. We already
So that's
had,
the new amount. The 88
Yes.
is the new amount with
New
this
amount.
addition.
yes. Yeah, so then we would need permission to contract with the White House for the total dollar amount of 88,974.
So
Do you need a request to waive the procurement policy? Not RFP, right? You've already,
Correct.
okay.
Correct.
So you just need approval from the committee to
Okay.
waive the.
Well, do we already have approval for the lower number?
sounds like there's two.
There's 2.
Some of the
Actions here?
two actions,
2
right?
actions on the table.
One's the amount.
Right, but did the amount just change and it's the same thing they're doing and it's just more money, so that we already have an agreement for the first amount, I guess?
That is, I mean, that is accurate. I believe it's just an additional funds that we
Right,
did not.
to the same
budget.
agreement, they're just getting more money in the same agreement,
Right.
so
So we're good then.
I
Yeah,
think so.
yeah, I think
Pass
so.
that total threshold, is that what you're saying?
No, I didn't know if we already had an agreement.
We already
with them.
have-
I think we already have
New
an agreement,
but
it's
did
just
you
more
know
money in the agreement.
Yes,
Okay.
correct.
So at this point, we need a motion to accept the 41,433.
That's all. I think we're good. Oh, we didn't have to- oh, yeah.
All in favor? Thanks.
Aye.
Let me just, and then going forward with the contract. Okay, do we need a motion to?
To amend it, or
So we just leave that as the contract.
Yeah, they're just giving them more money.
Yes, we're just giving them more money.
Good, thank you.
Okay.
Okay, so we're at the 2022 annual report.
All right. Excellent.
just going through your envelopes.
So our annual report, and I'll just review the youth bureau piece of it, because that is the fun side, I guess you would say. Mike would like to, his words to the board were really a theme of collaboration for the year of 2022, with a couple specific things that took place at the end of the year, which was the raising of the lowering age of juvenile delinquency. And we collaborated with both Warren County DSS and Washington County DSS to provide that service. Along with, we continued our collaboration with Warren County Probation on the Rural Communities of Practice grant. And then this year was the year that we were required to provide monitoring to all the recreation programs that are funded through OCFS and to the community funded agencies. So that took place. It was just in person. Leah Breer got to go to every recreation program just to make sure that it had some policies in place and safety factors and whatever things that they need support from for our agency. So it was a great way to get to know some of the programs We provided structured gameplay for Fort Edward Rec, Greenwich Rec, Salem Lunch and Play, Salem Lunch, Learn and Play, which were great opportunities for both our youth employment, because we bring our youth employment kids to set up games and to take them down, along with the gameplay for those recreation programs. I neglected to add that for 2022, we received a new funding stream that's called Youth Sports and Education Funding, which was designated from Office OCFS specifically to not-for-profit organizations that serve underserved population, which really narrowed it down for 2022, and it was a short turnaround. We funded the Challenger program, which works with youth who have developmental disabilities in a softball, baseball kind of programming, and that dollar amount was $6,700 for 2022. For 2023, however, it increased to $16,610, and those dollars come directly from New York State sports betting. So we anticipate that moving forward, that may be an ongoing funding stream that can support youth recreation programs that for physical exercise. So for this coming year, for 2023, there's 5 programs in Washington County, including municipal programs that have some increased funding. So that's a great new funding source that Mike neglected to put into this report.
There's 2.
Yeah, well, it's the same one. It's the same one. It's what he neglected to put in here. And then moving on to page 8, we collaborate with DSS on STSJP funded programs. And one of the programs that we added last year was, we call it PYD free pins. And those are for youth or referrals that we receive. It's voluntary, that we receive at a much younger, before they reach the point where a PINS referral is necessary. We're hoping to kind of nip some things in the butt before they go higher into the system. So it's truancy issues. We'll receive referrals from schools when a youth is missing a lot of days, when their behavior is poor, and we really try to engage the parents right from the get-go. Sometimes the Youth Bureau, they're a little less, it's a system, but it's not DSS and it's not probation, so we can kind of gain some movement. So I measured the parental engagement rate because it is voluntary. They don't have to participate, and sometimes we're doing cold calls because the schools or whoever the referral source have not even talked to them about it. So we have a 71% parental engagement rate, which is pretty good, I think, although we have nothing to compare it to, but I think it's pretty good for, we opened 41 cases last year, and we have some different types of closures with improvements in certain areas being measured, whether it's a truancy referral, we measure success rate, or whether it's behavior rate, we track those types of things. So 20 were closed with full satisfaction, and we're going to start measuring whether they then become a PINS case. So then we would have some comparison data. I believe 2 cases have moved forward since and have a full PINS referral has been made on. So that's a new program that we're working with DSS closely with. And then of course, youth employment is a great program. We served 14 youth last year that worked, 2 to 3, sometimes 4 days for, 4 or 5 hours. They painted the Fort Edward DPW fence and the Fort Edward Little League field. They did a lot of brush clearing and a lot of work there. Those were the 2 major projects that they took care of, along with the Salem shed behind the Salem courthouse. They painted a small shed out back, and then roadside cleanup and gardening and those things. We're looking forward to having that be serving more youth this year, if at all possible, with specific increasing like the work skills and really making it be that they have a resume and those types of work essential skills, because the kids are lacking in those areas. We have seen that they're lacking. Moving forward, we're still participating with the Safe Harbor. He had 23 referrals in 2022, with 20 of them were high risk for victimization, 1 for medium, and 2 had no indicators. And then another, on page 10, we had 3 of our staff trained this year for lifeguard trainers, because our volunteers that are great, Gretchen Stark, I'm gonna put a plug out for them. Gretchen Stark, Stephanie Randall, and Lynn Eddy have been volunteering to do lifeguard certification classes for a few years now with us. But they're perhaps aging, and we know they won't be around forever. So we have 3 staff that were fantastic swimmers and who are now trained as lifeguard trainers. They facilitated their first 2 classes this year, 2023, with the assistance of Lynn, Stephanie, and Gretchen. So they did a great job. Last year, we certified 19 lifeguards, 6 recertifications. 8 of those youth were Warren County youth, and then the rest were Washington County.
Just on that, note, Stephanie Randall's, I think, retired last year.
Yes.
And I think that she's trained about half of Southern Washington County in how to swim.
I think you're right.
And we'll be certainly missing her.
Yeah, she's still willing to help out at any of our training, so it's an added bonus for us. And then Safe Sitter, we taught 14 Safe Sitter classes last year, Washington County. We did 1 class in Warren County that served, I think, 4 youth. And then we did not have Winterfest. We did not end up having Winterfest due to weather conditions for 2022.
2 months
Or-
later, okay.
Yeah, or
All the same.
2023, I should say. 2022, we did not have it, but yeah, it's been 2 years. We're looking forward to that again, I think. And then I'll just highlight on page 12, the sheriff's camp. So we had 20 youth attend sheriff's camp last year in 2022. We're fortunate, Dee is right on top of the all of the paperwork needed, and we usually take any spots that other counties don't use. And we have 29 scheduled, 7 of which are Warren County for this year, but we have scheduled to attend, 29 scheduled to attend this coming year, which will be in July. And I think that's it for all the highlights for the Youth Bureau piece. And then the alternative sentencing, I'm sure Mike or myself will be doing that in the public safety meeting, but I'll just highlight that in 2022, we received our 3-year pretrial certification from OCA, which was the highest certification that you can get for the pretrial programs that are around the state. And page 29 to 32 just highlights some of the support services that we offer and collaborations and work groups that we offer with alternative sentencing staff, some of our staff with alternative sentencing and the Youth Bureau staff. So if you have any questions on the pretrial side, unless you want me to fully go through that. I know they have a lot of their manual.
Oh, believe me,
skills. I can fully go through that
Save a little bit
for public safety. All right. Any questions on the Youth Bureau piece? I believe it's in Caroga Lake area. They get on a bus at Warren County, and they start at Warren County, and Warren County, Clinton County, and Washington County. They all get on a bus. D usually facilitates either our sheriff's department or Warren County Sheriff's Department to be there with the dog or to do some sort of activity while they're waiting for the bus. And then it's a week long. I believe it's the 3rd week in July. And the kids love it. But usually they want to, if they're age eligible, they want to go the following year. So sometimes we have some repeat use.
So back before COVID, that our veterans department used to transport used to be here like on a weekend.
Yes.
And, we transport the children up to the main bus stop where they were gonna go with all the goodie stuff. And plus the actual, the van we use on the weekends. Take them up, pick them back up.
Yes, definitely, and that was very useful at the time, and now I think most of the parents are just dropping off.
That's amazing how much this department does. So thank you for this. I
Thank
really
you.
appreciate all you do.
Thank you. Any other questions?
Yes. Thanks, Sue. She does look like sunshine.
That was my goal today.
Good for you.
That's great, sunshine. First, I'd like to have the committee's request to do a proclamation for May. May is Older Americans Month, and this year the theme is Aging Unbound. In addition to that, in past years, I've had our honorees come and do a presentation. We do a presentation for our 2 Washington County honorees. You will see if there's a petition from the committee to also move forward with that as well.
Any discussion?
Yep.
Good.
What is the age limit for that?
It's 16 older, and that's in accordance to the Federal Older Americans Act. So anyone age 60 and above can be.
Any other?
Do you want to make your appointment now, Dan?
Sam knows
Yes.
now.
There you go.
And we're accepting nominations for 2023. If you'd like me to send you a nomination form. To do that.
Do we need a? Yep. All in favor?
In addition, this year we are moving forward with our Senior of the Year events with the Council of Seniors. The Council of Seniors consists of all the clubs in Washington County. And on May 11th at the American Legion in Hudson Falls, we're going to be having a big event honoring their Senior of the Years. And then most certainly I'll be acknowledging our 2 NYSOBA Washington County residents as well. Max is selling tickets for that event. So if you're interested in going, you can see me or reach out to Max.
What's the date again?
May 11th. Thank you. At this time, I'd like to present our 2022 annual report for Office for Aging and the Aging and Disability Resource Center. So I have a PowerPoint presentation to share with you. Thanks to the help of Debbie, I'm trying to pull this off. We had a little bit of hiccups, but I think we are successful in overcoming them. Following this presentation today, most certainly I'll be providing each of you with a hard copy of it. So every year, Office for Aging and DSS staff join together on a photo contest. Staff are asked to submit photos, drawings that commemorate Washington County. The photos and drawings and artwork is then placed up for vote. And this year, Mindy Dudley, Office for Aging senior typist of 17 years, submitted a photo of Route 4 in Kingsbury, which won the honorary status of our DSS and OFA 2022 annual reports. As I shared with you, OFA and DSS have formed a partnership, which makes us an Aging and Disability Resource Center, also known by the acronym ADRC. I'll be using the term ADRC and OFA interchangeably today throughout the presentation when talking about our department. Today, my goal is to be zoning in on the programs that OFA takes ownership of. The funding of the ADRC is supported by state, federal, and local funds, and by a few grants. New York State Office for Aging is our official state agency that provides us with all our guidance and is our central funding provider. Every funding source that you see up there on the screen has a very unique set of guidelines and rules that includes what percentage of local match requirement is requested. I'm proud to say in 2022, our budget was expended at a rate of 99.73%. With this, we utilized less local share dollars due to the increases in federal and state fundings. The guiding of our New York Connects grant, which precipitates the MOU between DSS and OFA. Here I'm showing to you some data that shows the collaboration between both of the departments in making us a one-stop shop for addressing the needs of our community members. Our co-location of staff and training that they receive from both DSS and OFA and their respective state agencies gives all of their staff the knowledge they need to provide well-rounded community-based services. Please know that our department structure is very unique across New York State. The next two slides highlight our New York Connects program. In 2022, our New York Connects Information and Assistance Program continued to be greatly needed, resulting in 3,296 information and assistant records being entered into our database. Here I've highlighted two charts from the annual report that shows our 2022 New York Connects data. Information requested is what individuals initially come to us for, and the information providing chart is what individuals actually left our office learning after our staff had a conversation with them and screened them for services. In 2022, the majority of people presented to us with questions around consumer and caregiver supports. The majority of the information we provided was around home-based services and home modifications and repairs. The information on the left of the screen shows the contacts we had with individuals 60 and older and 59 and younger. In 2022, we served over 3,000 people by either face-to-face contact, phone calls, and email, and our main mode of contact was by telephone. We served almost 500 more people in 2022 than in 2021. We also saw an increase with professionals working in local agencies or human services calling us for assistance. On the right side of the screen, you will see the top areas of assistance provided. As you see here, our primary focus was again on connecting and linking consumers with programs, agencies, and services, and that this number increased this year by over 600. Our New York Connects program also operates a long-term care council that consists of over 200 members, an online resource directory, and our long-term care council news digest that's sent out via email. In 2022, NYSOFA partnered with Oasis to distribute up to 100,000 doTERRA drug deactivation system pouches to local Office for Aging. Our agency received over 1,000 pouches to distribute, have been distributing them to individuals age 60 and older at outreach events and to any eligible individual requesting the pouches. This disposal system is a way to keep unused, expired, or unwanted medications from getting into the wrong hands. We also utilized our COVID stimulus funds to purchase and distribute digital thermometers, oximeters, and blood pressure monitors. In 2022, we distributed over 106 health monitoring devices. Here is a snapshot that shows some of OFA's core services. In the report that you'll be receiving, there's more of a description of each service that's listed on the screen here. During 2022, legal services ended their pause in services and provided 27 people with legal assistance. Our senior transportation, telephone reinsurance calls, EMDT cases, and services for the visually impaired did not see much change in the number of people served between last year and this year, while our ADRC and DSS transportation services doubled and our emergency response devices increased slightly. To address the transportation needs of older adults residing in rural Washington County, an agency called GoGo Grandparent was discovered. GoGo coordinates transportation services 24/7, utilizing Uber, Lyft, and taxi cab vendors. In 2022, we started piloting the program and served 10 individuals with a total of 669 one-way trips to medical appointments, dialysis, physical therapy, grocery shopping, and so much more. Being a caregiver is truly one of the toughest roles a person can have. Caregivers are most in need of physical and emotional support. We assist caregivers with physical support like respite, daily tasks, meals, chores, transportation, companionship for their loved one, and case management services. In 2022, the number of caregivers receiving case management services and respite services decreased. However, the number of hours our office provided had increased. The opposite happened with our supplemental caregiver services, as the number of people served doubled. This can be attributed to the addition of home delivered meals being provided to caregivers, which was started in 2022.
What's the unit of service?
So going back, I don't know if we go back to the previous. So a unit of service is based on the service provided. So for instance, transportation, 1 unit of service is a one-way trip. If you're talking about respite, like in-home services, then it's per hour. 1 hour equals a unit of service.
Thank you.
You're welcome.
Yeah, I wasn't quick enough on a couple of the other slides here.
Sure.
So it goes back to the fact that you serviced 600 more than we had the previous year, I think was the number that was there. You feel a lot of that's attributed to the fact that the building was once again opened up and the people could freely come. I don't mean that negatively, I'm just saying that, you know, they felt that they had more access directly to it by coming and trying to do it by telephone or whatever.
Yes, so I think, and that screen, tried to revert back to the service that we were talking about. Yeah, so we're talking about our information and assistance. I believe so, although we're not seeing as much traffic as we had pre-COVID for in-person. We're seeing that increase slightly, but really a lot of the telephone calls and emails are still increasing as they were during COVID.
Okay, thank you.
You attribute that to still being concerned with COVID and all the, it's almost traumatizing for that age group. So has it been that mass transformation and they're not going back?
I'd hate to make an assumption around that. It could very well be the case. We're seeing a lot of referrals come through a kind of a sister network where they reach people from the community, reach out to like 211 or the Unitas platform. And then those two platforms, 211 and Unitas, send their information to us so that we could work directly with the consumer. It's hard
I
to
know
tell.
with telehealth, there's a lot of stuff done on your iPhone.
Correct.
Yeah, I don't know if you do
Yes.
some of those same things, but
And I think demographically, we're aging.
yeah.
Yes.
For sure. For sure. Where is that?
One of the things that I would just offer, when I'm asked questions by the majority of the people in the community, is about referring them to the APRC. There are so many services that are provided there in whole through the entire department. But it's often giving them that number that they're calling in on that. Certainly, I'm not saying it's me doing that. You do a lot of outreach as well. There's information out there. I think people are realizing it's there and they're taking advantage.
Correct. Thank you for saying that. And as I noted, that the increase that we're seeing is not only from the consumers, but also from professionals. We get a lot of calls from nursing homes, assisted living centers, from the hospital, Saratoga Hospital and Glens Falls Hospital. We see a lot of care managers, discharge planners calling us on the professional level, trying to help them, guide them, give them some assistance in which direction to provide their consumers.
And with an aging population, it's only going to get more calls. And when you came to Hebron, I think for that, there was a lot, there's so many people that moved into the area that don't even know what we offer. And so it was very good for that because we had a big clientele that need to know what's available, and that has always been available. So,
Yes, we did start, I'm sorry. Well, we did start the Community Connections newspaper. So that insert in the free press has reached over 22,000 households. So I think that also can contribute to the number of increased in people reaching out to us.
It's interesting because I take our newspapers, the Asian box, and take them to the Salem Library. And they distribute them there. And it works out really
No, I
well.
think it's worked well.
Yeah, and then also the big piece is that like today there's a potluck luncheon, is that true? At the library. And so the people are connecting differently than they did before. And it's really nice to see that age group to get out of the house and actually and have that social piece that, you know, they do it during the day. They don't do it at night. You know, everybody stays in their house after 5 o'clock. If you want the elderly to come, then you gotta do it during the day.
And so on that note too, I mean, we did have our council luncheon last week. First time we've had a spring council luncheon since pre-COVID, and we had over 160 individuals participate, so it's phenomenal. And a lot of new faces.
And you're still looking to that pre-COVID, you're talking about moving some of the locations around instead of just the normal ones. Is that still something that's gonna happen?
Yep, we're doing the mobile events. I believe that's what you're
Yeah.
speaking of. We did start doing that. At this time, we're probably averaging around 3 or 4 of those events per month.
Good.
So reverting back to the slide we see here, our office provides in-home services for the purpose of giving individuals the opportunity to age safely in their homes and communities. Here I've listed the providers we contract with for personal care assistance, social adult day program, and caregiver respite programs. In 2022, the social adult day services were re-implemented with Fort Hudson, and we engaged in a new agreement titled North Country Home Care Services. With this new arrangement, our hope is to fill the gap in home care services in the north end of our county. As you can see here, our in-home personal care services are still experiencing a decrease in people served. At this time, we're assuming that the decrease in people served continues to be related to the contracted home care agencies losing home care workers and struggling to hire new staff.
Is there a Washington County every year? North Washington.
The North Country Home Care Services, they are serving the north end. Right now, that agency is the only agency serving Essex County.
Okay.
Unfortunately, or fortunately, I guess however you want to look at it, Essex County only contracts with one agency, and it's North Country. Given the close proximity and the fact that they have staff in Ticonderoga area, we were hoping to tap into that pool and serve not only like Putnam, Whitehall, and Granville. We're hoping to kind of bring it in. And so they're also sharing with us that they too will be looking to seek out staff in Washington County to kind of, if they can broaden their scope in our area and our region, then they'll hope to do that.
Gina, is there a point of that balance, because there's so many people at home that, you know, health-wise, it's not easy for them to be home. And so if you can't get a provider in to watch 24/7, sometimes you're left to their own devices with the phone calls and the support that way.
Correct.
And so when they can't find a workforce to do home health care, could you see the pick up that one change? Are you starting to see that?
So if I'm hearing you correctly, right now, our programs, the ones you see on the screen here, again, are non-Medicaid.
Right.
So our whole focus is to prevent folks from going on Medicaid and living in their homes for as long as possible. So with that, we do have some flexibility with our funding with home care providers, where we can say we could pay, like for instance, we pay the majority of our home care providers above a Medicaid rate with the hope of trying to seek more staff interested in this field. So it's kind of a challenge.
It is a challenge. You can see it in just people that are at home and in later years that are
Trying to stay in the home, trying to stay out of the Medicaid system. That's our goal.
in our community schools. So that's great. Thank you.
So here, as many of you are familiar with, is our nutrition services. In 2022, our data shows that more people were out and about. We saw an increase in meal participation, meal site participation, restaurant dining, utilization of farmers markets, coupons, and nutrition counseling services. Interesting piece in this is that we actually saw in our data a decrease in home delivered meals participants by 34 individuals, which actually brings us back to pre-COVID numbers. So I found that very intriguing when I was pulling the data from the previous years. In 2022, we were able to get back out into the community, as we just talked about, and start our mobile pop-up meal sites. We had our senior picnic this year. We facilitated our health and wellness fall festival. We hosted a fall senior council luncheon, and we were able to have our annual in-person public hearing and conduct several outreach events, which we just mentioned. And we also increased in 2022 our daily home delivered meal routes to 11, allowing us to serve the Putnam area with hot meals 5 days a week. It was truly invigorating this year to be able to get back out there and to be in person with all of our community residents. Also new in 2022, we received our new vehicles for our nutrition fleet, and we also started our free press supplement titled the Community Connections newspaper. And I already shared with you on a monthly basis, we serve over 22,000 households in Washington County with the supplement Community Connections. May is the Americans Month. As I spoke about earlier, it's a time to honor and celebrate our senior ambassadors. Shown here are 2022 honorees, Debbie Behan of Hudson Falls and Dale Brunell of Fort Ann. We celebrated Older Americans Month a little differently again in 2022. Instead of having our typical statewide celebratory event in Albany, we had a virtual live event on Facebook, and we all gathered at the Kingsbury Fort Edward Senior Center to watch the live event together with our honorees. And as many of you are aware, we also honored our awardees at the Board of Supervisors meeting. So thank you for taking the time to listen to my presentation. The presentation, the annual report itself is on our web page, so you're welcome to look at that.
Thank you.
What I always share with our folks is that we use it as a tool. So when you look at this, you can kind of see, hey, I've got a consumer that may have some questions about services. You're welcome to revert back to this to see what we see all that we do and what we can provide to them.
It's a very good reference. Thank you.
Thank you for your time.
Thank you.
You know that.
Yeah.
Thank you.
Yeah, 2022, I would say that was definitely highlighted for sure.
Yeah, let's do that.
Okay.
And would you like to come forward and we'll get the agenda and do my way?
I was gonna give you information
Oh,
related to what you asked.
Start.
Yeah, I think you can certainly
Thank
put
you.
it at the table if that's all right.
Yeah, thank you. Come on up and join
There you
us,
go.
please. Thank you.
You didn't even give you the day and a half chair.
It's okay. If you don't want the information, you just want him to tell you. It's all right with me.
We want to.
So I have some information.
So I did provide a little bit of information last month to chairman, and in the event that there was any conversation being generated in between then and now, because we knew at that time that this was a request that had been made to the county. The indigent burial rates are something that most of you probably wouldn't have ever even given a thought to or been aware of. That it's something that is set by the legislature, but it is part of this requirement is listed and included in social services law. It is directing the local DSS in each county to be able to pay for the funeral expenses when there is no legally responsible party that's been identified that has the funds to do so. Also, when there is not a prepaid, obviously, funeral or some sort of an estate that is able and willing to pay. And also, just incidentally, I'll mention that it's become more common practice now that with deaths, that people do a GoFundMe page, for example. If that is the case, and we are aware of it, yeah, they are no longer, they are certainly not eligible for an indigent burial at that point. It would be the GoFundMe funds that would take over on that. So just a little bit of background. The maximum claim that's allowed by the state is $900. And so regardless of what we do pay, that is the cap amount that we can claim. If it is a TANF eligible burial, which would be somebody that is open in a TANF case, temporary assistance for needy families. So in a family with children, it would be 100% federally paid for. So we would get the full $900 back, but otherwise it's going through safety net, which is what the largest majority of them would. And at that point, because of the reimbursement rate, we would be down to $261 that we would be recouping for the county. So the difference between what we pay and what the state reimburses us is all local cost. The difference between what we pay and what it costs the funeral homes is all funeral home costs. In 2021, we had 59 burials. In 2022, we had 61. So I'm seeing that as a pretty stable figure. The total payout between those 2 years was $263,926. The amount that we received back for reimbursement caps out at 12%. So this is certainly not anything that is regulated as our usual funding streams are through DSS.
They have a parentheses denied, a certain number denied. Is it denied for payment or denied for?
Eligibility. They weren't, yeah, they were not, they would have applied, but they, for whatever reason, generally, I would imagine being about the income or what funding was available for them, they were denied. So there are some things that have some play here. I've given you the chart. The request that came to the county was made by the Adirondack Funeral Home Directors Association. They have already spoken with Saratoga County, and Saratoga County has already made a change. I have that here for you in the chart that I provided. And then I just added on Warren and Washington as it relates to that Adirondack area in our neighbors. Would you like to pick up here?
Yeah, we haven't talked to Warren County yet, so I've got to meet set up with them. But I'm Tim Murphy. I'm from Kilmer Funeral Home. Pat set this up. He was supposed to be here, and then he decided he'd go to the Outer Banks for a couple of weeks. Called me this morning and says, "Oh, I forgot."
He did not call you this morning.
Close to it. I mentioned it to him before he left last Friday. Oh,
He
yeah,
said he would be.
that?
He said he'd be thinking of all of us.
So, one of the things we're requesting are I want what we call a full burial, full service. That would be removal, embalming, the whole works, with a calling hour and a funeral. Just the casket and the vault, which is required by the cemeteries, cost us $2,020. That's our cost for it. And obviously, we're getting $2,000 from the county, so we're already $20 behind. So, you know, one of the things that we sent out, I didn't bring one for everybody. I thought Todd sent them. That one of the things we were requesting was for a full service burial, we would get raised to $3,000 plus the wholesale cost of the casket and the vault. Our costs, as you all know, funerals are going up and up and up, just like everything else, you know, cost of. Our cost for a full service funeral right now runs around $11,000. Just that inexpensive casket. For a full service cremation, which is we call it full service cremation is the cost of using what's called a rental casket and then cremation afterwards. That's our cost for that is around $8,700, or our charge for that would be around $8,700. And for direct cremation, which we get $1,000 for, the total cost for us or total charge from us would be $3,600 with the crematory charge. There's certain things that out of that $3,600 that we don't pay for, you folks don't pay for. You allow, I think, $500 is it family?
Yes, $500 supplement.
They allow
Yes.
family to supplement $500. The county does. Warren and Washington County do. Saratoga doesn't allow the family to supplement anything. So, and you also do pay for the crematory charge, the county does. Now, you also pay for a grave opening for cremations. I'm not sure, because I think that cremation is the final, So
I'm sorry, I don't know the answer to that.
yeah, that's something that I don't know either. We'd have to look at, because cremation is fine.
My guess is that my person that's doing the eligibility wouldn't make that distinction, and she would believe that if the choice was to bury an urn, that would be something we would pay for. But I don't know.
Okay,
I don't know for sure.
Saratoga County, no, but I think Warren, Washington. So, as we are requesting, I will get copies of all this and get them to you. I'm sorry I didn't bring them. I was kind of thrown into this. But, so we're asking for like a direct burial. We're asking for $2,000 plus the cost of the casket. And the
So do you have something that can make copies for you? I can get them real quick.
I do.
That'd be ideal.
Well, he's doing that question. What's the story, full service burial, does that include the headstone?
No.
Now, will the cemetery allow burial without headstone?
Yes.
They will.
Oh, yes. Yeah.
What goes there? Some kind of marker?
We usually put a temporary marker there, which is just a metal thing.
Is that,
That's not required by the cemetery. Vaults are required by the cemetery. But headstones or grave markers, as they're called, are not required by the cemetery. There has to be nothing.
So that would be something perchance if the supplementation was high enough, the limit of supplementation was high enough, it might be something that
I
families.
would say that you don't want to increase the supplementation because the family, if that was the case, then obviously they've got money. If they want, you know, a grave marker or a headstone, we usually don't take care of that through the funeral home anyway. If
Yeah.
they want that, they have to go to Boy Scouts or somebody and do that themselves. So. But, the biggest thing I think is, you know, the cost of the casket. You know, we're $20 behind already with the, you know.
It's like your base metal.
Yeah, so I mean, the cast, that's our cost. There's nothing we can do about that. That puts us right now $20 behind. Obviously, just like everything else, our costs of the caskets and the vaults are gonna go up every year.
The supplementation, if that were to increase, and it is higher in other counties, I had previously thought that it was a flat 500 and that was limited by the law, but it is not. I've seen it up to 2,000 in some other counties. And when I had talked with Todd, he felt that that might be a way for them to recoup some of their costs that maybe otherwise are not paid for. Like the fee for the clergy and some different things of that nature. It's entirely up to you, and the recommendation has been not to increase that, and I totally understand why.
Because that just gives them, obviously, they have money.
If they were to buy, if they were to be able to buy a headstone, for sure.
To
Right.
buy a headstone and even increase, you know, the $500, you know, that can cover they want a piece of flowers, or usually with, you know, covers the clergy, some death certificates. The post-star, obviously, the post-star is up to $350 minimum now to put an obituary in, but you can put an obituary, a death notice in, which is 90-something. You come out of that supplementation. But if you put, you know, if I'm gonna say, you know, if you increase that, then they're gonna say, oh, well, we can do this, we can buy flowers, which they may do anyway, but they don't do it through the funeral.
That, just flat information, if you, increasing that does not do anything to change the eligibility or our reimbursement. It would purely be something that is covered of expenses that are otherwise.
Right. It's not that.
And so that would be a direct cost to the county?
No.
No, it would not be.
No, that would, if the supplementation is, if they want to purchase some flowers.
Oh, no,
We're talking about the increase.
So the supplementation, if you allowed families or friends to provide more payment towards other costs, not the costs that are here on this chart, other costs that we do not pay for.
Right.
If they were to try to pay for all of that stuff and they were a legally responsible person, a legally responsible party determined by the law, then absolutely that money should be going towards the burial instead. But if they are not a legally responsible person and they want to provide some of those extra things that are typical of humanity, it would not impact our eligibility, our reimbursement, the cost of the county at all.
Now, is that why some of these were denied? Because
It could have been, yeah. I had hoped to be able to extrapolate a lot more from our data than I was. I wanted to be able to tell you how many were safety net, how many, you know, what the cost was over and above, but we don't have enough.
A lot of them, you know, when we call you folks and stuff there, they do a real good investigation. And they find out that there's a bank account, there's money here, there's an insurance policy that, you know, said, oh, there's no insurance or anything like that. And then that's automatic denial, you know, no, this person has a $5,000 insurance policy. Stuff, which obviously we don't know when they sell us, we have no money, we don't know and everything, so we send in the paper call, send in the paperwork and talk to them. County does the investigation, and that's, I think, where a lot of the ones that are turned down, you find out that there is money there. They're just trying to. So I, you know, so I think one of the, you know, like I say, the biggest thing is the $2,000. That cost us $2,020. Just before we do anything else. Obviously, if it's full burial, we gotta do bombing, we gotta have, you know, staff for calling hours, we gotta staff for, you know, funeral, the hearse, drive the cars and stuff like that, so.
What are the current costs? What are the current payments?
Current
What
payments,
do you get currently for
Tony,
full burials?
And that sheet.
it's a year.
we get $2,000 from the county.
But you're asking for 3,000 plus the whole.
Right, well, that's just what we're asking for. Obviously.
Right, but if
you
we
should-
gave you that, it would be over 5,000 actually.
Yes,
What's interesting, if you look at, he's already been to Saratoga County, right? And it shows post 2014 and then effective 4/1/2023.
I believe what Saratoga County did is they raised everything
So
10%.
it shows the numbers that they came up with.
Right.
And some were already higher.
Saratoga County, some of my, right. They were hired to begin with in some cases. Saratoga County also, which Washington and Warren do too, they pay Saratoga County up until this increase here, which it doesn't show, agreed to pay for the crematory charge, which they didn't. And that's $400, right? You know, on top of everything else. The crematory, which Warren and Washington do pay for the crematory charge.
So when it says cost, we already paid for it.
Yes.
Yes, you already paid for the cremation fee.
In any of those lines, and in this chart where it says cost, we're paying
Right.
what their charges, what their
With
fee is.
the cemetery charges us or the crematory charges us, yes.
Makes sense. Bob, did you have a question?
In a purely indigent situation, the person dies in a nursing home on Medicaid, there's no family, no nothing. Who determines whether it's a normal burial or cremation?
We could act according to the state. Okay, if it was purely and there was nothing, we would have to come to your county attorney and have them agree to a cremation, sign for a cremation. We cannot cremate unless we have a signed piece of paper. But as you're saying right there, it would be up to the county attorney to say, okay, I will sign it. We cannot cremate without the next of kin signing a piece of paper. If we can't find anybody in the county, so I'm not gonna pay for, you know, then they're not gonna authorize that, then we have to bury them.
Which would cost
So
us more.
it's generally burial, right?
One more service your county attorney.
Yeah, one
Yeah.
guy I was not aware of.
Neither was he, quite frankly, because I've never done it. So, nor would I without some
Yeah, there
indication.
probably are very
That
few
was-
instances that would be. that
We-
I just was wondering if,
Generally speaking, I've been told it's a conflict if I agree to do something purely because it's the least expensive.
Right, and the thing is for you to sign that and then 5 years down the road.
Yeah.
Some grandson or somebody shows up and says, where's my father? Oh, we cremated him. What do you mean you cremated him? I want, you know, so I can't think of any county attorney that's ever.
so yeah, we cremated, but you owe us $1,000.
So
Okay.
that really can't happen without. We have to be able to say, here he is, he's buried here. Well, I want to move to Pennsylvania. Well, if you pay for that, you can do that.
So as a committee, do we want to review the information that we just had and make a motion to send it to finance?
I think that's what we're asking for. I mean, as we've done before the board in Saratoga saying that
Any other questions?
Yeah.
Dan?
If you get notice of a veteran that's declared to be.
We would look to them to see if they do have any, if there's any standing that would allow for veterans to be able to pay for it or any other funding other than us. Oftentimes, from what I've been told, when we have them, they generally are not.
Yeah, the only thing that's always concerning about that, it's not to deal with the system in its whole. As many times there's veterans that have gotten bad discharges. And when you go back and you review the thing, when we go to get them claims, they should have been separated differently in the military than they were. It wasn't just get the hell out of here because you're trouble. They had maybe seen all of the casualties and all of those things that they had and never got the treatment they should have got while they were active.
Right.
And we see a bundle of those, especially now that they've come through with some of the newer laws that go backdate them to, Vietnam era, that type of stuff.
Yes.
And I know down in the New York City area, one of our chapters down there, Vietnam veterans are very successful going back in and getting those with proper documentation from the records, getting those discharges up. Something that becomes a burden. So these guys can be taken off the shelf and it's going for 5 or 10 or 15 years and go to a national cemetery.
We don't, I mean, the veterans money goes, if there is any, which you would find out about. I mean, sometimes, if they had a disability or something like that. Normal, say a normal veteran is eligible for a flag,
Right.
plaque and burial at National Cemetery.
Any other questions for Tammy or Tim?
So I just want to clarify this. So right now for no burial, you're getting $2,000.
Yes.
What's the cost of the casket?
No, it's 2,000. We're asking for the cost of the casket and the vault. It's $2,000. It cost us for the casket and the vault. It cost us $2,020.
We're essentially looking to go from $2,000 for everything to about $5,000.
Well, obviously, just like everybody else, we're shooting for the moon and looking to get.
Just wonder what the cap of the moon is.
It's looking to get something.
Your 2020 does include the casket?
That 2020 is the casket and the vault. That's what it cost us.
Yeah,
Casket and the vault, doesn't.
include the burial, right?
Well, the burial is paid for by the county, the grave home and stuff. And if the lots needed to be purchased, it is, but it doesn't include any of our services. In other words, we're losing $20 right off the top before we do removal, embalming, arrangements, calling hour, funeral, and transportation to the cemetery. So with the $2,000, we're automatically losing $20.
So if I understand this, Saratoga County went at 2585, which includes the casket and vault.
That still includes the casket and the vault, yes. They increased theirs, I think it was 10%.
They added the
And they added
cap cost.
the what?
Is the grave liner the same thing as the vault?
Yes.
They added that at
Oh, they
cost.
did.
What's not on here?
Yes, it is.
Where?
Basic concrete grade liner cost, Saratoga effective 4/1.
Do all cemeteries require vaults?
Yes.
Old.
Todd
What's that?
said that they are.
I know a couple that don't.
Pardon?
I know a couple that don't.
We must be real rural.
It is good.
We are,
Huh?
we are.
Over at Union Cemetery, there's one section that was older, and they don't require vault, but they charge twice as much to open the grave in that section because eventually the casket and everything deteriorates, the ground. The vault's like, your foundation of your house.
Isn't there a move to green burials? Isn't there a move to green
There
burials?
is a move for it.
Oh, yeah, and they're legal in New York, and I've had more questions about them last year than I care to mention. It's not- But it's, people want to do that because it's just like every other save the earth type thing.
The green burials is a big thing. There's, you gotta get the cemeteries around here that would accept a green burial. That's the next thing.
But yeah, they want to do it on their own property, a lot of.
And that can be done, but you have to go to your town, you have to get a special permit to do that and stuff. So that we have done that on, on farms and stuff out in Washington County. So.
Moving this finance.
If you, are you making a motion?
Yes.
It's-
What are we moving?
Yeah. are we gonna-
Finance.
All the problems associated with this.
This discussion over.
Well,
Well, we have
do we
not.
want to make a recommendation, I guess is what I'm asking. I think I would, the cost of the basic concrete and grade line, I would have actual cost. And the others the same. It's quite a step up from where we are, that's for sure.
So the adult burial, you moved from 2,000 to 2,585.
I was just gonna leave it at the two, but I was gonna pay for the total, their actual costs down at the bottom. Just like Saratoga did. But
It's
it,
cost of the grade liner.
yeah,
Add the cost of the grade liner to this table.
To the 2,000.
Yeah, to the table down here.
2020 includes the casket and the grave liner, right?
that's what that's what he thought he said too.
Yes.
That's what I thought he said too.
But that isn't what it says basic concrete grade liner is the only thing they're paying.
Well, in other words, by basic, it's called a min crypt, okay? It's a concrete grade liner. It doesn't seal, it's concrete, it's not lined inside, your vaults or grave liner, whatever you want to call them. They go from anywhere from a grave liner on up to a bronze lined vault, bronze top.
The sarcophagus kind of look.
Yeah.
But if we went at cost, plus the $2,000,
It's already there.
it's already there, then that gets you more in the black than it does in the red.
That would, yes.
That's what I was.
The cost of the grave liner. Our cost for a grave liner is $1,260. That's what it cost us. $1,260.
And that's all that Saratoga, that line that Saratoga says cost us.
That's what they pay is $1,260, right?
So we'd be increasing our contribution. by $1,200.
But
If we just,
the casket and the liner together are the 2020.
Yes.
I was suggesting we paid both of those and leave the numbers the same. That way, because they're always gonna have to pay for the casket and the liner, no matter what, and that would always increase. You expect.
How do you limit what's spent on casket? You have.
That is the
plan.
minimum casket.
That's what
That cloud.
If you were to increase cost in the line where it says casket and put cost,
the minimum.
I think you would need to specify
Yeah.
what kind of casket you're talking about.
Yeah, which is a.
Well, I
called
think
the grave
that's,
cloth.
I think that's a fair way to handle it.
Just so I understand it though, whatever we add is a direct cost to her budget. There's no
Yes.
reimbursement on
No,
it. So
that's
you're
true.
talking 75,000.
You're
If it
talking,
was just the grave liner plus whatever you're adding right now.
if you did the casket and the grave liner, you'd be talking $2,020,
More than what you.
more than
So
2,000.
that on 59, I'll call it 60, $120,000 we're adding to her budget.
But if we won't bury the dead, what are we doing for the people that are alive?
So that's an extra $120,000.
No, I'm just saying that the impact, it was that clear before we're voting on.
Yes, it is back to $120,000.
That's if it's all.
For me, in simplicity, I broke it down to who should bear the burden of burying the indigent people. should it be the county? Or should it be funeral homes? Or should it be a combination of both?
And it is a combination either way, so. That's why I would.
So we have a motion on the table. Right, but
Do we want to consider raising the family supplementation or not?
I'm thinking now, because well, I mean, if you raise,
You mentioned before that.
if you raise that, you know, the family obviously then has got money.
You're allowing the money, you're allowing the family to contribute $500 right now to the services. Whatever additional work they would like.
That's fine.
But Tammy had talked with Mr. Gilmore about that, so where were you thinking on that, I guess?
What was I,
Where's your guidance on that?
a recommendation?
On the supplement?
I don't think it would hurt to increase it to 1,000. I understand what you're saying, but I also have heard that there's not a lot of people that actually supplement at all.
Well, there's not, I mean,
And you mentioned that the obituary is $350.
the obituary alone is 350.
Yeah, but we're going into,
But that's allowing.
I'm just gonna show my view on this. We're providing the basic necessity, right? That's what the taxpayer should provide. You know, to me,
Well, we're not,
announcement in the paper is not a basic necessity. Basic necessity,
but we're not paying that, so they're allowed to pay that, is what you're saying, right?
that's, my point is, what is the county allowing? $500 will cover it right now. That's my point.
Okay, no, I've lost something here.
Well,
The supplementation money is actually whose?
Friends.
By his family.
it's by the
Right.
family.
Non-legal.
So that's not taxpayer dollars anyway.
I understand that, but what he said before is, if they have that much money to contribute, why aren't they paying for the basic service?
Because it's not the person that's legally,
responsible.
Well,
It also
you know,
isn't
I wasn't
covered
legally
anyway.
responsible for my father's death, and I put a lot towards it too. You know what I'm saying? So it's, that's my point.
and I've been down that road too, but I'm just saying, why would we keep,
No,
no, why would
my
you
point
keep?
is, if the family has enough to resources to do these things, then they should do it.
We put all the obituaries online, which a lot of people just say, just put that online. In other words, yeah, we have a webpage and everything. Whether they put one in the newspaper or not, it is online.
Yeah, Burlington Press, $800.
it's interesting, if you think about, okay, so an indigent person, say at the nursing home.
Right.
Okay, all the workforce there all of a sudden realize that this person doesn't have any money at all. They all contribute $100 or $50 to have this person so that they have a burial like other people might. But the minute that goes over the $500, in my opinion, and correct me if I'm wrong, if the donations reach to $750, all of a sudden this says, okay, they're not indigent anymore, so there's $750 and we don't get anything else. So it's a denial happens.
Yes,
Correct.
absolutely.
And so $750 is not going to be enough. They've been denied, and all of a
It's
sudden
not
that
gonna be
funeral
very
home is going to bear the brunt of burying the person. I think that's the way I
Yes,
heard it.
of everything.
That's what I was trying to understand how it works.
Yeah, so in this case, Saratoga doesn't have any of that for a trigger. So virtually that's unlimited, so they're not setting the cap.
Good
Is
point.
that our understanding on that?
Good point. Yep.
No, Saratoga County, okay,
There's no limit.
does not allow anything.
It's the opposite.
Right, they can't. It's not unlimited because they can't say,
You can't do
well,
it.
here. In other words, if we do something in Saratoga County, they go, well, we want to do paper notices. As far as the funeral home's concerned, you can't do that in Saratoga County. You can't supplement nothing.
So we're already
Yeah,
on the soft end of this conversation. Certainly what we allow family.
I think though Saratoga County, people it doesn't come into the equation.
Doesn't come into the funeral equation.
Right, it doesn't
Right,
come
if
into.
they
the
wanna
equation.
go, if they wanna go buy flowers,
Right.
they can do it. If they wanna submit an obituary, they can do it. Same, they're not supposed to hear, but, we limit it to the, say, this is what you're allowed. And while some flowers show up, we can't say, oh, we can't take them because you were only allowed, it says dad, I don't, right, but that's, I think the other, one other thing we'd like to see is a little bit of which Saratoga County once again did at 10% and everything in the direct cremation. It's at $1,000. We'd like to see that, if we could even put that up to $1,200 instead of just $1,000. Because that is big part of our business today, is cremation. Well, direct and full service cremation.
I'm still confused and I really hate to even be digging into this. I'm gonna bury myself. But
No pun intended.
But what I'm trying to understand, right now with this chart, what's the maximum amount of taxpayers' money that can go to a funeral of an indigent person?
Whatever you approve.
No, with this chart, what's approved right now?
Right now, it would be $2,000
That's all, no matter what the
for
funeral.
a complete full service funeral.
Right, no matter what happens, the most you'd have to pay is, the county would, the cost would be.
No, it would be $2,000 if it's a full service funeral, plus the cost of the grave opening. Okay,
Cremation fee and the
Or-
plot.
plus the cost of a plot. So if there's no plot, if it's a full service, if there's no plot, and it's a full service with a burial, with a vault and everything, then I'm gonna say the county pays, depending on the cemetery, roughly another $1,500. If you have to buy a plot and pay to have the grave opened.
So that would be the total cost of the county, 3,500 minus the 900 that we're gonna get reimbursed,
Yes.
right?
Yes.
Could be 261.
Right.
That'd be
Under the
different terms.
situation.
And so what is it, the motion on the floor? What are we increasing that to? But I'm just trying
It's a
to
change.
understand.
Basically, it was 2020 was what we were increasing the cost of the
No.
casket and the liner, right?
No,
No,
that's,
if you did those
So we
two.
were adding those two things, but we're gonna put that at cost, so that's what it would actually cost.
well, the liner was gonna be over 1,000
Right,
plus the
He's
2,000.
talking the 2020 would be on top of the 2,000.
right.
So it'd be
Right.
Who's next?
$4,020.
Plus the 1,500 for the
Plus
plot.
that,
and
they had,
So-
yes.
But those are already, those aren't new, those they've already got.
No, but that's the total, I'm trying to establish.
Yeah, that
the
would be-
total
yeah.
cost of the county.
Yes, so yeah. For a full service,
Another way to look at what we're talking about is if we redefine the term casket, say basic casket, or casket print basic. If you said that at cost, you said the basic concrete part of the cost. We've got the other items at cost, right?
Right.
So they're not in the red on just
casket in the ball.
on casket and the ball. And then you adjust the numbers at the top. If you choose to. And we're only paying at cost.
But if we pay their costs, we don't really need to adjust. Because they were making less than what it was costing them.
Correct.
If it was costing them more than correct.
So my point is that right now, adult burial, it would get at cost, if we did that, it would get at cost plus 2,000.
Right.
So we'd have to adjust whatever we think is appropriate.
That doesn't mean it's their cost. we're talking our cost.
Yeah,
Their cost is gonna be far
It's their
more.
cost.
That because he has to hire people and
Well, right, I mean, that's
that's where the.
that's,
Correct. That's what that number up top would reflect.
Reflect.
So any contribution towards the funeral home's cost is not being reimbursed.
I say, one other thing would be the cremation, direct cremation, which is $1,000. That's,
And probably more gonna take that route because it's just. a
You know,
But if we put that at cost, is that?
well, no, I mean, there is no, the cost, our part of that is what we have to do, make the removal. Disinfect the body. We use the cremation container is a wood cardboard container. So that's, make arrangements, transport to the crematory, pick the ashes up from the crematory and stuff, so that's $1,000. So if we could get that increased by even 10%, like Saratoga County did, and that stuff, that would be a big help to us.
Okay, we've got Sam here.
Yes, my quick question is a quick one, I believe. So this is not just for the funeral home that you work for. This is for everybody that's involved in the association. in Washington County?
This would be Warren, Washington, Saratoga. Saratoga County is Tammy put, they got a 10% increase overall on everything. Plus, they got the cost of the crematory, which we already have from your two counties. Plus they got the cost of the vault.
Right.
For a full service burial.
But do we do indigenous burials in Washington County, correct?
Right,
We
yeah,
don't do the other two.
the others are just
No,
a
no,
comparison.
They were just comparisons.
Yes, but the ones that we're actually talking about here would be, it's not the association, is it association?
No, it's just the association. We did this as our association's 3 counties.
Okay.
So we're going to each
But
county.
is this gonna be for each funeral home in Washington County? That's what I'm
Yes.
asking. That's the question.
No, it would be for
Every-
anybody that has a Washington County.
If they
Yes,
qualify
that's the
as,
If they qualify from
having
Washington County.
been a
You might have
resident.
somebody from Saratoga County who is in a nursing home in Saratoga County, but they were a Washington County resident on their Medicaid. And that's where
Yes, if we consider them to have been a resident,
Washington County at one time.
it doesn't, whether they're buried in Rensselaer or.
And it doesn't matter what
Otsego.
funeral home,
Right.
the
No,
way I understand it.
no,
Okay. Well, I didn't know if we were gonna be doing, if it was and that's why I asked the question about
No,
funeral
right.
homes in Washington County.
no, it wouldn't just be funeral homes in Washington County.
So then if you
It'd
went
be
to
if they were
Saratoga, you have to
Washington,
accept our
under
rate.
Washington
Yes.
County services.
I think that's kind of what I.
They would accept our rate, okay.
Okay, so now I put my finance committee hat on. Using the term cost is hard to predict and budget for.
But you're not right now on any of the other things. You're just adding one more to it, but
That's my
we're
point.
figuring 60,
Doing a counter argument. to
yeah, it's
myself.
120,000.
If we put a value on it at this point, based on what he knows, then we'd have some kind of budgetary target to hit. Right now, if you just put cost on there, when they send you the bill,
Right.
you're paying for it. You don't know how to budget for that.
Right. Cost
It's pulling from our safety net line and our TANF line, which.
cost would be, it goes up every year, obviously, so. If you book, you can't, you budget, say she budgets for this, and the cost of the vault is $1,200, let's say our cost of the vault is $1,200. Next year, it might be $1,400, $1,500, who knows?
And it does already with the plow allowance and the cremation costs and the great opening and closing. Those are all buried over the years still.
Oh, much so.
So is the motion, to your point on the motion, to your point on the motion, could we move this to finance to redefine the cost structure? Take this table?
Well, I think that's what we would do when we get the finance, but I think we should have a recommendation of what this committee would want to go to finance. That's what I was thinking.
Is it cost or is it a dollar value? Did we say that cost or we put it down?
Well, I'm going by what they've done in the past. And I'm just thinking that if the price of a funeral is including the cost of the casket and the grave liner at the moment, then maybe we should include those so they always at least get paid for what they're putting in.
Right.
Put those at cost, move it to finance, because we're gonna have some supervisors who just like hand out shovels and say, on your day, you go out shovels, so. We still got.
How much is that shovel gonna cost?
I'm thinking of offering to move that to next month.
But I think, well, we should look at the cremation part too, of
Right, that's,
that he wants that.
we,
And 10% on it.
10% would work, so
that would, you know, anything.
I would amend that,
No,
10%.
So what I'm hearing is this motion includes a 10% on the direct cremation, right?
Mhm.
Okay, and then we're going to put the basic concrete grave liner at cost,
Yep.
And the casket costs.
and the casket at cost. Okay. And is there any thought on the moving the up to $500 so the denial piece is not affected by?
We're gonna hear that whole argument again, and I can't come to a conclusion of whether it's better or not.
Okay, so the motion's not going to include that. But this motion to get it to finance will include those three things so that we can discuss it there unless Tammy has a.
Did you say just direct cremation or all of these other fees?
Just the direct cremation.
So is that what the motion said?
What does now?
Okay, so we have a motion to second. Any more discussion? All in favor? No. Thank you very, very much.
Okay. Time to be back. No.
Send them to finance.
So you-
He'll never do that again.
Thank you all.
Thank you very much.
Yeah, anybody else? Take care.
And you're up for annual report?
Yes, I'll make this quick.
Some things didn't happen.
That guy was not a salesman.
I got a ton of questions. I got a ton of questions that I don't want to ask.
What they should, and I understand that it's a lucrative business. It's a service to take care of the people that come for it. So,
This is like our worksheet on our desk.
How do you determine they can't afford it? They do research.
Well, I figured with all
For
that,
Medicare and
I was gonna
Medicaid,
need
it's
to
the
make it
same
be
thing. They go right through everything.
handy. Now, where the hell is the one that I had as my copy? So, does anybody have one that has highlighters on it?
But we're,
You gotta
Right.
I had, oh, here it is. Oh my God, see, I would have been Johnny on the spot if we could have gone in order.
boy, that's the way to do it. Time yourself, you shouldn't have been out of order.
I think she's doing great.
Where's the meat already deal?
All right, I'm gonna start with this side, the side that does not have the purple on it.
Okay.
So we do have a full report. We do the half-size page. Gina will hand those out to you after. I wanted to just pull out certain things and bring them to your attention here for the purpose of this meeting. The part at the very top of this talks about our overall agency goal, our mission. Certainly has always encompassed empowerment, self-sufficiency, personal responsibility, and independence. With the pandemic and the changes in our programs, the changes in our culture, that was very difficult over the last couple of years, and it has created a level of unrest within our staff. They are sort of trying to figure out what really are we supposed to do. And so that's something that I've mentioned in the past, and it's something that we are working to get ourselves back on track with to the degree that the culture allows it. As far as people being able to get into apartments and apartments being available, and the state does not change any more of the rules. So just to bring your attention in here, the total number of CPS reports was up. No. Total number of primary reports was down. The total number of secondary reports was up. The total number of children named in the reports was up by a significant amount. It was close to 600 kids. So that surprised me. Wanted to draw your attention to that. The child preventive stats that are next to that, those numbers are all up. And I do think that that is a factor of, again, where we were seeing things with the lull through the pandemic. For instance, where it says we had 40 CPS referrals in 2022, we had 20 the year before that. The PINS referrals, we had 48 from the schools. The year before we had 28, or 48 the year before we had 28. Juvenile delinquents, we had 14 last year, and we had 6 the year before that. Our adult services numbers are all largely in line. The petitions filed are a bit waffly, but not anything of huge proportions, unless you have something that you would like to point out if it's a struggle.
Well, so like one thing in both adult services and adult guardianship that's kind of relevant to what we just got to talk about is guardianships. More and more folks are declining to deal with their elderly parents, relatives, siblings, or whatever, and that defaults to the commissioner in many, many cases. So we have plenty of people. Normally, your normal guardianship is somebody who doesn't have any money, doesn't have any assets. It's a fairly easy guardianship to administer. There's not a lot to do with it. You just pay their bills with what little money they have coming in, make sure they get medicated and go home. We've been getting more and more sophisticated clients, wards are what they're called in legal terms. You're the guardian of that person in the ward. They have all kinds of real estate holdings, all kinds of stuff that all have to be liquidated and managed by Tammy and or us and or outside counsel and Gina's people and everything. So as folks say, this is too complicated, I don't want to deal with it. They don't have to. They're not legally obligated to. There's a difference between morally obligated to and legally obligated to. In a lot of cases, they're choosing not to deal with it. It devolves to Gina's people originally to do all the work. Tammy ends up being stuck as the guardian. My office ends up doing a lot of work. We've done work with somebody that owned property in California. We've got somebody now who owns multiple rental apartments in multiple counties all over the state, and firearms and all kinds of good stuff that we're dealing with. So we're seeing more of those, but not only are we seeing more of those guardianships, we're seeing more complex guardianships, I guess, which takes more time and effort on the part of everybody to do. The folks at the BSS level, the ones that do willing to work in that. But they do necessitate sometimes hiring people outside counsel that is well versed in all the different intricacies of how to do this, because we are not a state planner by any stretch of the imagination. And I think Al will tell you that he's getting stuck with a lot of estates or administration of a lot of estates from the same reason. People just don't want to be involved in it.
I'm the only one that does not have the right of refusal.
Right, and Tammy doesn't have the right of refusal either. When the wheel stops spinning, it points at her.
Yeah.
We do our best, and Gina's people do a really good job of talking to all the possible people that can be guardians and explain to them and helping them along the way. But they say, I don't want to deal with that.
Yeah.
They don't have to.
Can you tell us where that's changed, like in 10 years from today? Is it 50% more than one?
I'd say the total number of guardian cases is relatively stable. We've had lost some, gained some,
Right.
but the property ownership and
Complexity
all of
of
the,
it is really
the one he talked about that had property in California, it was tied up in some special.
It was in California land use regulations are tough. So it was in some special coastal something or other district.
We had to
couldn't just sell it.
We had to find people that could deal with all of that, work all that through. The same person had stocks in her name. She had stocks in her mother's name, who was deceased, but she was the beneficiary. We had so many different things to work through. And this new case he's talking about, I think, is going to be even worse.
Where does that money all end up?
It all ends up going to mostly the
Medicaid.
person, Medicaid, the support of the person in the end. But you still got to do something with all of these assets.
Right, the administrative costs is the burden of the county.
Right. That falls on.
That's what I meant, but so none of that offsets any of the burden that or just
It
whatever.
honestly largely will go back to the state.
Yeah.
Medicaid.
But it was interesting listening to talk about the burial, not assuming, you know, that they don't have to take on those costs. And whereas a family might before, what we're seeing now is more and more families just going, or, you know, I've got 3 siblings and 2 of them are great and one of them is a nightmare to deal with, so they just go, I'm gonna deal with that. And it ends up devolving down to DSS in a lot of cases. So I don't think you see more of them, but you see the client tends to be much more asset heavy and many more things going on. We had one client. I actually went to the curator of the Hyde Museum and went through the house because there was so much stuff in it. And the family said there might be valuable artwork there or there might not be valuable artwork there. So I don't know the difference between starving artists and Picasso, you know? So we had to find somebody. Unfortunately, she agreed to come over. We spent 2 days going through this house. Looking at hundreds of paintings.
And lots of other fun stuff.
And lots of other fun stuff, right, which we won't talk about, but it's just odd things like that that I'm running into now, whereas before it was somebody that, you know, went into a nursing home, was indigent, it was pretty straightforward, it wasn't a lot to do.
I didn't realize that, at the conversation we had with this, I didn't realize that we had so many folks just doing that.
Yeah, I think it's a new trend because the cause.
It takes a lot of, it's difficult being a guardian, you have to file a report, you have to do an accounting. There's a lot
If you're
that
actually
goes
working,
into it.
it's hard to make time for some of that
Right.
stuff too.
Yeah, so it's not easy, I'll give you that, but when somebody says, you know what, or these guys will do it for something, because sometimes that's not a difficult decision to make. So just be aware that that seems to be a trend that we're encountering last couple of years, especially.
You just don't have the specialty for it.
Right. We just,
So foster care stats, you can see what they were in comparison to last year. The one thing that's startling to me is that so far in 23, we have already had 7 youth enter foster care. So more than we had in all of last year. I don't know that that's indicative of a trend that it's going to continue in that way, but it's startling to compare the numbers. I think Gina mentioned that when you pull the data and you look at it, it's like, whoa, what does that mean? I included on here because I think you would find it interesting, and I certainly do, the difference in the number of hours that were worked and whether they were in a straight time or overtime. The on-call time shifted minimally. And you might remember that we added a second on-call last year, so that shift was negligible, but the other increases are outstanding and certainly speak to the burdening of the work and how complex and such our cases are. It also shows, I feel, in straight time, we were down significantly because we didn't have positions filled in the past. And so that's, you know, in 2022, we had that pickup. We backfilled positions that we kept open, that sort of thing.
Amazing, the 21 people in provisional status.
Yes, that's very difficult, even particularly when if somebody is employed full-time someplace to take a position with us that's provisional, it's scary for people. It's scary for our staff that take a promotion provisionally because the tests have not been given. Yeah. Benefits on the other side, the benefits paid out by program. The TA TANF line is actually down from last year. Last year it was $1,052,653. So you would think that's a good thing. However, it really amounts to a shift to what went to safety net. The amount of safety net is up by $420,000. The amount overall that increased in total TA benefits between 21 and 2022 was $405,000. So we've had that swap of people going from TA or from TNF to safety net because they have timed out. They're no longer eligible for TNF, which is limited at 60 months in anyone's life. They're going to safety net instead. Those costs are increasing, and that certainly increases our local cost for that. The homeless numbers, as I've been saying all time through, those numbers skyrocketed. I'm showing 66 families here. The year before we had 16. 201 single adults. The year before we had 142. So that was when all of the eviction moratorium was in place. People were sort of holding and they weren't coming to us, and that busted open last year. Another thing I would, the last thing on here that I really would want to point out to you, and I don't know what it's indicative of, but it's incredible. Down at the bottom where I have what the weekly shares is and what the amount that was paid out by DOH New York State to providers that are charging Medicaid. That what it is showing here as over $160 million, whereas in 21 it was $18 million. I don't know what that shift is about. But as I had said before, when we were thinking that the state was going to do something funky and change how we receive Medicaid, the FMAP, and what our shares were going to be and all of that, the costs are skyrocketing. Somebody's going to have to pay for it. So just sharing that information with you. And then the other half of that page is a handout that was provided to us. We've got it in our office. We've given it to people. It illustrates why it is beneficial for them to work rather than collecting benefits. So all of that is in the report that Gina has. It's also posted online.
So this first block on this page tells me a story that I don't know, and I know you mentioned it to us before, and I talked about it. That benefits paid out by the program were people right here in this county.
Yes.
That figure is over $30 million if you total that. It's more than our sales tax that we take in. And I think that is huge, because if you took that 30 million out of our local economy, it would be devastating. So for all the hype and talk about social services to the negative, what would you do without it? I mean, it just tells a whole different story. And I think it's a different story from 10 years ago. That might have been half that number.
Yeah.
So that's how much it adds to our local community.
One thing, Ryan, that may make you as budget us feel a little bit better though, unless I'm mistaken, Tammy. The SNAP is evaluation of it, it's not the actual dollars that went out our door. We don't spend 20 million on SNAP, that's the pass through.
It's
not-
right. It does not go through our budget. It's not even in our budget.
No, but
Yeah.
I want to make sure that we understand that that's the valuation.
Right, no.
Yes.
I'm
these
not
are the
looking
benefits.
at, I'm not looking at the negative of what we spend. I'm looking about the positivity of what it does to our local community.
That's dollars.
If that did not come in to our people to spend, some of them would be starving for
Right, and
number
I'm just
one.
trying to make sure that everybody understands.
Yeah, no, I'm
the
on
flow
a
through.
different page.
True. And what Al says, it's a valid point. The TA, TNF, TA safety net, and the daycare, those are all numbers that you will see in our
Direct budget now.
Yeah.
budget. The SNAP and HEAP, while they used to be
Right.
in the past, it really inflated what it looked like DSS got for revenue because it
Yeah,
was
wasn't
all
it wasn't a
100%
value
money.
judgment, Brian. It
Right.
was just
That
a-
used
If
to-
we were just looking at a
It does
different
not
angle,
anymore.
that's going directly into our economy.
It is, absolutely.
And that is the fact that that's more than what we take in sales tax. And SNAP more than likely doesn't make sales tax. Stop that. I mean, it's just a huge number.
The SNAP number will drop
Yeah. Well,
because of that supplement. That
food prices go down.
no, the SNAP number is going to drop regardless of whether
Do it again
prices
here.
go down.
Yeah.
Because the benefit levels go down.
And I don't know if you're the right person. There are still people that I'd look to volunteer in the community. Is there any kind of repository or a place people can go? Like right now, everybody I deal with can't find volunteers, but I've also got another group of volunteers that can't find a connection that needs volunteers. So is there any kind of repository that are like food pantries or soup kitchens, or is there any one place that there you can kind of coordinate volunteers with people who need volunteers?
I think that there has been in the past, there's an RSVP comes to mind, it was some
They
sort of
do
an
stuff like
organization
that.
of that nature. We would probably be looking for people to do some direct services, and that would offer
I was just gonna say that might be a
preschool
great place.
experience as well as the food pantry experience. Community garden, there'd be a wide variety directly through Fleet. Through us, it would be providing goods that we would be able to, like, for instance, to give to foster homes or foster children. There is very little, like, even when we have people placed in supervised employment situations, it needs to be through the business or, the government entity that takes them to supervise them.
This would be more like community service projects, whether it's like, roadside cleanups or, going down and maintaining flowers at the visitor centers, whatever, with some kind of, if there was any kind of place that you could coordinate that kind of activity.
I know in my own town,
Okay.
they started like a Facebook site for people to,
Sure.
be able to put in that they want to volunteer. Other than that, I don't.
And I think that's community driven now. This is my
Community by
experience.
community.
Yeah, it feels like it. I don't know that we've heard it at the county level, but every community has
Something local.
right.
Okay.
And, you kind of go towards what you enjoy doing, and then you come more often.
So maybe send the groups more to their local, reach out to the local, even their local town board. Okay.
I think
This is interesting. You're looking at this county and you think family of three not working, family of three working. Having watched those numbers before, so much of that goes back to the availability of childcare. And if you work 8 to 4, that's great. You might get childcare, but if you're a job working 3 to 11, are you gonna find childcare?
Right.
And boy, it's tough. It's tough. I'm sorry. I interrupted
okay.
you.
No, I was, move on.
Ian?
If I stepped down for a minute, and if I missed it, and you already explained it, I'll talk to you later, but on the bottom of that side of the page in green.
Yep.
County cost of Medicaid weekly share paid to New York State, 9 million. Is that weekly?
Yes, those are
No,
weekly
that's-
payments.
That's the annual amount.
Oh, I'm sorry. They're weekly payments. That's the annual
The
amount.
total of the weekly pay?
Yes,
Now, that's what we pay New York State?
yes.
Okay, and then the next one, explain the Medicaid payments to county providers through DOH.
Any provider that bills Medicaid
That's the.
Oh, okay, that's the one billing.
within
actual
Washington
cost.
County,
And also,
that's what's been paid out.
our cap is around 11.2, which is about 2 million higher than that 9.2.
Which will be going back too soon.
Which will go back to soon, just so you know. We've been there before, but we just need to go back there, but yeah.
They did pass that, right?
Them past
They're
the
both
part you're
temporary
talking about,
monies.
but then they will eventually let us go back to the cap and even quicker if some of the other.
As the BEF map and the COVID F map are both temporary
Yeah,
reductions. So
that's our reason why it's reduced.
Thank
Any other questions for Tammy?
Thank you. Related to the annual report, I'm ready to move on to a mini van purchase request.
Perfect.
And then I have one other add-on thing. So the carpool bid out for minivans recently, and they are aware, DPW is, that DSS is in need of a new minivan for our carpool that we use when we're transporting children or families for things. We, at this point, are using a van that had been an OFA meals delivery van. And so if you agreed to how badly those needed to be replaced, you know how bad our minivan needed to be replaced, that we took one of them. So I would plan on putting that into our 2024 request. There are, though, funds left within the current 23 budget, and there needs to be a transfer between 22 and 23 related to when 2022 cars were received. That's something that Becky spoke with you about. When you close the books, money will come to 2023. That will end up having $42,024 left in that line of what has been provided and budgeted for. The bids for the vans that DPW received is less than that. It's $37,296. So I would ask that you approve. I would recommend that we buy one, and I would ask that you approve us to buy one. The $25,000 threshold remains a thing still though. So that's that $25,000 that we have spoken about in the past, and I would figure one of the two of you or both of you are going to ask me about that as soon as I shut my mouth.
I told that.
I asked you not to ask NICEAG. You can ask me. So the $25,000 still remains what the state will allow us to claim and write off right away. So they'll reimburse us for that $25,000. They would not reimburse us for the $37,296. It would be something either we would need to completely absorb as a county cost, or we would need to depreciate it over the course of 3 years. So that would be a choice left.
So moved.
We have a second?
Yes.
Yes. Any other questions on this? Okay. All in favor?
Thank you. And you guys will figure out whether we're depreciating or eating it.
We are.
Yes.
You can let
You'll tell us what we need to do? Okay.
Brian, do you want this moved to finance?
It has to go finance. Yeah, because it was budgeted. That's why I came here.
Motion to move to finance.
I thought you said.
That
That was part of that motion.
All right, and did the packet that you received include a resolution that we are adding in? So we'd like to recognize an additional $85,000 that is under the naming of COVID-19 funds, and that is because we received funds through this allocation in the past that we spent out, but other counties did not. So the state was scooping that back up and wanted to know what counties might be able to spend it if they were to reallocate it, and we volunteered. So we requested and said that we'd be able to spend an additional 125, and they gave us 85. And we're going to use that to offset the cost of the beds that we have in shelters, the contracted beds.
So do we have a motion to?
Take care of that.
Second, okay, all in favor?
Aye.
All right, thank you. Now, if we go late, it's because of public health.
A lot of buses have been stuff like
That's where better yesterday.
Good afternoon.
Good afternoon.
Good afternoon.
Well, I will be quick.
All right.
I'll try. Okay, moving on. The first thing I have is a request for a resolution to actually purchase new and upgraded AEDs, AED trainers, and CPR mannequins. So it would be 100% grant funded under our immunization grant. So we'd like to request to move money from our 0.4 account to our equipment account, and the total amount would be $4,250.
Okay, any questions? All in favor?
Aye.
The second thing, I've mentioned this, and it's been brought each year, the county health rankings. It is a nationwide ranking system. It's put out by the University of Wisconsin Population Health Institute. And what they do is they go and they rank each county within the state. It is done nationally, but they do it within New York State. So it's 30, we were number 33 out of 62 this year. And the rankings came out at the beginning of March. It's based on health outcomes, which represent how healthy they perceive the county is right now, versus health factors, which represent the things that we need to improve the health outcomes. So the same type of things came up on those reports that we've mentioned before, from that had been brought to light through our community health assessment. mental health, obesity, smoking, access to exercise opportunities, teen births, lack of providers, which is tough within our county because we don't have a hospital. So they do look at the number of people within the county and how many providers there are within the
Did
county.
we move up or down?
We actually moved up.
That's what I thought.
Yes,
Seems
yes.
like we moved up because we're almost in the middle.
Yes, so we moving up. So in 2022, we were number 34. So this year we're 33. In 2021, we were 39, and the year before that, we were 41. So we have been progressively.
Everybody's getting worse in front of us.
You know, it is, some of the statistics that they use are a little tough for our county because again, we don't have a hospital. So it's hard, and we don't have a lot of providers within our county. So that ratio is quite off compared to the state and the nation as a whole. So those same type of things, motor vehicle deaths is another thing they look at, which was significant for our county. And also the child mortality was high for our county. So those are the statistics that kind of drive that number. So I just wanted to bring it to your attention. It is available. If you just go to Google or go to the website and type in county health rankings, you'll be able to pull up all the information and type in our county. And then you can actually compare it to other counties as well. So,
Is there a homelessness piece there in the list?
there is, let me just see, I have all the statistics with me here.
So that went up.
It did, yes.
It should have it in most.
And that will affect health and well-being.
Yeah, it's not sticking out to me specifically on here. They do talk about, you know, poverty, children in single parent households. It does break it down into that much. Talks a lot about the social and economic factors as far as disconnected youth that are neither working or in school, and that was high for our county. It was 17% versus 6% for the state and 7% for the nation. So that was another
What's
factor.
showing the child mortality?
The child mortality rate,
Well, that was disconnected youth.
that was disconnected youth. Child mortality, and this is, this is for children under 18 from 2017 to 2020, and this is per 100,000. So you got to break it down because we're not at 100,000 population. Right. So Washington County was at 50 versus New York, which was at 40. So it is interesting information, you know, if you want to take a look at it, but just it's like I said, it's a little skewed based on, you know, what we have available within our county. So
it's amazing when you start looking at the numbers, like teenage pregnancies or like the use of tobacco. You think the things that we think that they should be all taken care of, yet they still remain at the top of the list.
Yeah, teen births.
We keep moving up.
Yeah, well, like I said, I think the ones above us are getting worse, so we're moving up the ladder. But I think the smoking thing was a big thing with COVID that actually got going.
Vaping. I think they put vaping under smoking.
I guess the question is, you know, where do you get the most bang for your buck? You know, do we focus on a couple of key factors and try to bring those down a little bit? I don't know what the strategy is. Something to think about.
Yeah, and I think with the prevention agenda with New York State, that's what they kind of ask us to do as a public health department through the community health assessment is, you know, identify those priority areas. And that's what, you know, we tried to do with this, next several years, which we had presented last month.
Right, and we put our dollars to match that, so the resources.
It'd be interesting to see the
children mortality, how many of those are tied to drug and alcohol pickup.
Yeah, that's what I wonder.
Yeah. Okay. So, and then I just have a quick program update on our Move Your Way Trails Day. We were notified by Adirondack Health Institute, who's one of our partners with the Trails Day. They had contracted with an outside agency to do a marketing campaign through the reality check program. And they're going to incorporate the Trails Day event into like a 15-second commercial that's going to be on social media. So the departments that are involved with that with the county may be mentioned on there. So I just wanted to bring that to your attention in case you see that. That was just more for your information. Okay. And that's all I have. No, that's it. Okay, I'll try to be quick. Thank you.
Okay. And do we have any other?
So I just have one thing.
Okay, Sam.
I learned something from yesterday. Yesterday, when Chairwoman Fedler was going up to her meeting, she walked by me, I wish her good luck. And we got out at 1 o'clock. Today I said, nothing to you and we're out of here now. Not chairperson, good luck out here.
Thank you. Any other?
Maybe we should bad luck.
Okay. Adjourned. Thank you very much.